Not too harsh.
Very good so far, guys. Thank you. So I am arguing in favor of 25% dextrose prolotherapy today in the treatment of musculoskeletal pain. I kind of took a different approach. I talked about some research, but I also talked about kind of the history of prolotherapy for a little bit and maybe some side tangents on theory. I wanted to draw us back to just the history of prolotherapy in general. Dextrose prolotherapy was first used in the 1930s by Earl Gedney. He was a general surgeon at the Philadelphia College of Osteopathic Medicine. And he injected his thumb, and he did this because they found that the American Society of Herniologists used similar solutions to repair hernias. So these findings were originally published in 1937. And eventually, later on, the term prolotherapy was coined by Dr. Hackett not too long after that. I make that point just to really emphasize that we have decades more history of use in clinical practice with dextrose prolotherapy than perineural or other lower concentration dextrose based treatments. And so I feel like that decades of history really um, contributes to the reliability of the therapy. And I think it's something we really need to consider. On the counterbalance of that, perineural injection therapy, which is, closer. Obviously, we're talking about 10%, which is going to be a little bit different than perineural. Perineural is a 5%. But us studying and looking heavily into these mechanisms of action that have to do with the lower percent dextrose, we haven't done that nearly as much because perineural injection therapy wasn't really invented until around 2005 to 2010 when Dr. John Liftoff um, completed that process. But so with the perineural injection therapy, it's a 5% concentration and it's a little bit lower. Um, so I mention all this again, just summarizing that we have much less knowledge when it comes to the neurogenic effect that perineural is having on the body. At least we have less time of looking at those mechanisms of actions. And so I think we really need to rely on that bedrock of foundation that we have within higher concentration hypertonic dextrose prolotherapy.